The attempt is to change the breast aesthetic from a breast that has descended over time to one that is more youthful. And so the goal is a more youthful, attractive breast. And so the goal obviously is a natural looking breast. Now, if you're 50 years old, the breast may naturally look more descended as opposed to a 30-year-old. And so the goal is to match the breast with a aesthetic and a youthful appearance for that patient. The patient also needs to understand that they can have scars that are visible. Most scars fade well, but whether that is perceived as natural or not to the patient is up to the patient. And again, we spend a lot of time educating patients with regards to the benefits of breast lifting as well as the limitations with both pre- and post-op photos, education, presentations, etc. The type of scar that results from a breast lift depends on the style of the breast lift that is needed, and the style of breast lift depends on the severity of the descent of the breast. Some patients with very limited breast drooping can get away with a straight breast augmentation. However, pushing that too far can lead to suboptimal results. So other women will need an incision around the nipple. Other women will need an incision around the nipple and vertically down, like a lollipop, and still others with the most severe breast drooping will require an incision around the nipple, vertically up and down, and then horizontally like an anchor. This is a very standard pattern. They are hidden under garments, but clearly when the garments come off, the scars can be visible, and scarring is individualized depending on the patient, and we spend, again, a lot of time talking to patients about that with regards to how they'll heal. Every patient is different, and so in summary, the scars are not hidden unless they're undergarments on, but the scars do fade with time and do mature quite nicely on the breast. A breast lift starts with the consultation with the surgeon. We spend time getting to know the patient and the patient's desires. We also examine the patient and look at the limitations of the breast as well as the tissue characteristics. We discuss smoking, and certainly smoking is something that we try to discourage with this particular procedure. We then spend a lengthy process educating patients on the benefits as well as the risks of surgery, and this includes looking at pre- and post-operative photos, the patient asking questions, and the surgeon educating the patient as well. And once we decide the patient is an appropriate surgical candidate and that we believe that we can address the patient's needs, we then have a secondary consultation or a pre-surgical visit. We then go to the operating room. Again, we also address other procedures if needed, for example, a tummy tuck or some other type of procedure that might or might not be combined with the breast lift. Surgery tends to last between an hour and a half to 3 hours for a typical breast lift. It can be done in conjunction with a breast augmentation, which is another topic worth discussion. After the surgery, the patient goes to the recovery room, and if it's their only operation, they tend to go home that day. For combined procedures, depending on the procedure, we will keep them overnight if needed. And again, Park Meadows Outpatient Surgery has a state licensed overnight facility on premises, and so we can monitor those patients in appropriate settings. The recovery time really depends on the patient, but typically patients tend to go back to work about 1 week, and they continue to wear a post-operative bra for shaping and support for about 6 weeks or so. The results a patient can expect begins with what the patient starts with as well as the evaluation. The goal is a more attractive breast with a more elevated shape and a more youthful shape and a nipple position that is more appropriate on the breast. Again, the results also depend on the technique that is used and whether an implant or breast augmentation implant is used in conjunction with the breast lift or not. The goal is an aesthetically attractive breast in a more youthful position in a more fuller shape. When choosing a doctor for a breast lift, you go through the same steps that you would choose a physician for any other malady or any other problem of your family. This includes looking at certifications and education and training. Usually you're looking for a board-certified surgeon who has breast as part of their expertise, board-certified plastic surgeons work with the breast and body through an extensive period of time and training. Also, you're looking for someone who not only is board certified, but someone who is educated and makes breast surgery a part of their normal practice. The more surgeons perform of a procedure, the more likely you'll get a good result, and the more likely you'll minimize, but not eliminate, but minimize the risk of complications. And if those complications do occur, those surgeons have seen them before and know how to deal with those complications more competently. And so board certification is one with regards to plastic surgery and cosmetic surgery, as well as surgeon experience.